Hello and welcome. My name is Greg Lomason, and today we will be covering obesity in Texas. According to stateofobesity.org, Texas is ranked at number 10 with a 35% obesity rate among adults. Texas has some state and national policies in place, including SNAP, summer food service programs, and national school lunch programs, and the Youth Risk Survey System, a self-reporting survey system of at-risk behaviors among high schoolers. Students have reported low PE participation and high sedentary activities like computer usage and TV watching. And back in 2001, Texas had passed SB 19, which had required 135 minutes of PE per week by law. But as you can see from the 2022 survey system, 65% of students report low PE participation and question why this is. To the University of Texas, SB 19 failed miserably because schools largely just disregarded it. This might have happened because policy should be focused on education and physical activity, and your target audience should not be grades K through 12. I think it should be on young adults between 18 and 35 who can make their own decisions and are least affected by conditions outside of their own control. I think policy should be enacted outside of schools and within the general public, specifically within the fitness industry and parks and recreational departments. I think Fed, state, and local agencies that connect those two together, like transportation, should have an active part to play in city planning. Texas specifically has done a great job with creating policy focused on physical activity and health, due in part to the transportation agencies. The Federal Highway Act of 1962 led organizations within Texas to reorganize how they design cities. Texas led a focused effort to include all governments in this planning, which led to the formation of the um, Central Texas Council of Governments in the 1960s. I'm going to refer to them as NCT for short from now on. He currently has over 230 member governments and has been working with advocacy groups since 2006 and 7 to address the state's obesity epidemic. NCT first adopted plans to purposefully change travel behavior in 2011, which included the regional VeloWeb plan, a 2,200-mile network of off-street shared use paths throughout Dallas-Fort Worth, or DFW. In 2011 and 14, Highland Village and Louisville adopted long-term plans to integrate their local city travel and rec plans with the NCTs. In 2016 and 2021, this integration led Highland Village to spend $11 million to connect 10 miles of the city's bike paths to that 2,200-mile DFW VeloWeb network, and also led to Louisville's $46 million rec center called Thrive, which they won a gold award for from the NCT. This work by all parties had a large impact on my personal life as I lived in Texas between 2011 and 2020. In 2016 and 2021, the Texas Department of State Health Services implemented policies regarding health professionals and corporations, including OPP, which is the Obesity Prevention Program. That program sought to strengthen public and clinical health referrals, increase the number of health plans that reimbursed for obesity screening, prevention, and treatment, as well as implementing corporate wellness plans that implemented evidence-based guidelines and environmental changes in Texas work sites to increase access to opportunity for physical activity. In summary, though education and policy within elementaries has failed, there is still hope within Texas to combat obesity. Surprisingly, the NCT and transportation agencies are actively working with local governments to not only educate children and adults, but also make living a healthy life accessible within their own lives and daily, that given the choice, most people will choose to be active and healthy. I think we can all learn from Texas in this cohesiveness towards city planning within local, state, and federal agencies. And I think that we can lot from incorporating those activities in our daily lives.